Welcome to Check Up with Bluegrass, your monthly dose of health and wellness tips from the team at Bluegrass Community Hospital. My name is Cliff Wilson, Market President for LifePoint Central Kentucky. Each month, we talk to a healthcare professional in our community who is passionate about keeping Woodford County healthy. Today, we are putting our best foot forward, literally, by welcoming Dr. Jared Malin, podiatrist here at Bluegrass Community Hospital. Dr. Malin specializes in foot and ankle care, and he's here to talk about the common podiatry issues, how they can impact your overall health, and what patients can expect when they come in for care. Dr. Malin, welcome to the show this morning.
Thank you so much. Just want to say I'm grateful to be on the show this morning, and really appreciate being a part of the team here at Bluegrass Community Hospital.
Awesome. Let's get started. Why don't you just tell our listeners a little bit about yourself?
Sure. Quickly, I've lived in Versailles now for 6 years. We've been in Kentucky as a family, almost 10. We started our practice here with Bluegrass Community Hospital in 2020, and I've been practicing in Kentucky since 2016.
Very good. So what inspired you to become a podiatrist?
It's a great question. Get that a lot. I always knew I wanted to be a healthcare provider. I was pre-physical therapy initially in undergrad. Shadowed several healthcare professions and subspecialties and really connected with a podiatrist in my area, and that set me on a path to where I am today.
Very good. And you treat a wide range of conditions. Could you talk about some of the most common foot and ankle issues that you see in your practice?
Certainly. Here in central Kentucky and really across the United States now, diabetic foot care has become at the forefront of some of the complications we see in the diabetic population. In addition to diabetic care, we commonly treat heel pain in our factory workers and our farm workers in the horse industry. I see a lot of pediatric patients, ingrown nails. I am also involved with Campbellsville University, and I'm the foot and ankle consulting surgeon for that team. So we have a pretty eclectic practice, treating anywhere from kids to adults and our advanced seniors, and we really see a wide variety of pathology in our office.
Very good. What are some of the signs or symptoms that people shouldn't ignore when it comes to their feet and ankles?
Certainly. I think it's important to listen to your body first and foremost. If something feels off in the lower extremity, it's important to check that out with your primary care provider and get a referral to my office or come see us directly. Most important, I would say, signs and symptoms of infection, first and foremost, pain, redness, swelling, heat coming from the extremity, are obvious signs of infection. Those need to be seen quickly, and those type of symptoms aren't something you want to sit on for long.
Very good. A lot of people tend to ignore foot pain or simply just brush it off. Why is it important to seek care early rather than wait?
Sure. I think in today's world and in this county with a working population, a lot of times we tend to push things off, maybe try to wait it out till it gets better or self-treat. I think neglected injuries in the short term and long term can become worse pathology or problems. So I would say if you have a naggy injury that's not improving, don't wait long. And in the case of diabetic patients, it's critical at the first sign of infection, a callus underneath the foot, a blister, an early wound. Those type of symptoms really need to be seen quickly.
Okay. Can you tell us a little more about the surgical and non-surgical treatment options that you offer for things like bunions, heel pain, or sports injuries?
Yeah. First and foremost, my goal as a lower extremity specialist is to treat patients conservatively. When you come to my office, First and foremost, we're going to talk about conservative care, non-surgical options. In certain situations, certain fractures, certain diabetic wounds, chronic conditions, a bunion that's getting worse, severe arthritis, there is a need and a place for surgery. I really want my patients to be educated and take part in their care, and I want the patient and I to be on the same page as to what our goal is in surgical intervention. So, in short, I prefer to treat conditions conservatively without surgery first,
Right.
and then move on to that surgical space when the symptoms warrant it and the patient's ready.
For sure. What types of patients do you typically see? Is podiatry just for older adults, or can it also benefit younger patients as well?
We kind of touched on this earlier. The bulk of my patient population, we do treat active adults, and we do treat a lot of diabetic patients. But truth be told, my passion is with an active population, and I have treated the youngest patient we've performed surgery on was one-year-old patient, and I've also done elective surgery on a patient in their 90s who is still very active in the Falling Springs crowd here in town.
Yeah.
So again, it's very patient specific, but I want patients and the community to feel confident that I do have experience treating patients from the cradle to the grave.
That's great.
Yeah.
Dr. Malin, tell us a little bit about how you work with other providers at Bluegrass Community Hospital, like primary care doctors, nurse practitioners, our wound care center, or even our swing bed patients in the acute setting to create a comprehensive care plan.
Absolutely. I've been very impressed with our staff and the hospital here at Bluegrass Community Facility. I really enjoy the community feel and the team that we have. Our wound care center has been wonderful. Our newest provider there, our nurse practitioner, Stacy Bellotti, has a breadth of experience and is excellent in the wound care center. I'm not here every day of the week, so it's great to have a wound care center to rely on and treat at-risk patients. Dr. Smith is a genius, expert primary care provider and internal medicine doc here on the floors and in his private practice. We work closely together, and I'm happy to consult every day of the week for patients in need with lower extremity conditions on the floors. I can't name everyone in the facility, but our nursing staff, the rehab facility, our physical therapists, we have two great orthopedic surgeons, Dr. Price and Dobner, doing surgery here. And I'm missing people as well and other subspecialties, but we do work as a collegial group and a team, and everything within our purview and ability here at the hospital, we really try to handle in-house, and avoid sending patients to a bigger facility where we can.
Healthcare is a team sport, right?
Absolutely.
Let's talk a little bit about diabetes and foot health. What should our diabetic patients be aware of, and how can you help them prevent serious complications?
Right. Well, the American Diabetic Association and our different primary care boards and recommendations all agree that all diabetics need a foot and ankle screening. And from that screening and referral to podiatry and that risk assessment, we will stratify patients based on risk. And I have some patients that need to be seen on a weekly basis for their wounds. Other patients I'm seeing 6 times a year, every 8 weeks. And a lower risk diabetic patient will be seen yearly. I do think it's critical that every diabetic is seen and evaluated for their risk factors for diabetic foot care.
Good. Are there certain types of shoes or foot care routines that you would recommend for keeping your feet healthy?
Yeah. First and foremost, I think stretching and maintaining that pliability and range of motion in our lower extremities is critical as we age and remain active. The shoe industry has become more and more technologically advanced to the point you look in marathons and some of these shoes are even banned now because they're dropping times based on the design. I break down patients into 3 basic foot types, whether you're a pronator or flat foot type patient, more of a neutral or normal foot, or a cavus supinator. And from those 3 foot types, the shoe industry, I'm not going to name brand names, but there are some really good high-tech products out there. I recommend going into a running store and being fit, find your foot type and size, and from there, choose a shoe that's comfortable to you and accommodates the activities and needs of the individual.
Yeah, great information. Are there any seasonal foot issues that people should be aware of, like injuries from summer activities or maybe problems that arise during the winter months?
Yes. We focused on diabetic care a lot in today's podcast, but I think it's really important. Diabetics are always wearing shoes in the heat, out on the asphalt, or just walking to get the mail. I've seen injuries develop. We live in a humid state, and especially right now, we're feeling the effects of that. Athlete's foot's very common in the summertime. Obviously, in the winter, I recommend wool socks in patients that are at risk to avoid frostbite or some of the conditions with what we call vasoconstriction or limited blood flow. Apart from that, just always making sure you've got supportive shoe gear when you're out playing pickleball or hanging at Fallen Springs, those activities. So.
You also treat injuries like fractures and sprains. When should someone go straight to a podiatrist versus the emergency room or an urgent care center?
I don't think it's ever a bad idea if you have an injury that's extremely painful and there's question it's swelling. I don't think it's ever a bad idea to get to the emergency department and have that acutely cared for. There are some guidelines out there that I practice by. The auto ankle rules, in short, to summarize, would say if you can't walk on the extremity, you need to be seen acutely by emergency medicine provider. I'm happy to get in and take care of patients and consult here in the emergency department as I live in Woodford County, and try to make myself available that way. I would say an injury that maybe you're just hobbled by and is more in the achy range, and you're still able to weight bear. You're not seeing a bony prominence poking out, or you're still able to weight bear. You could probably wait and see me in office later in the week.
So, to our listeners out there that may have never been to a podiatrist, can you walk us through what that typical office visit looks like when they come to see you in your clinic?
Sure. First and foremost, we're in the old Dr. Sanchez office out in front of the hospital, Suite 300 here on Amsden, and it's a beautiful space. We've got lots of waiting room space and a comfortable environment. So initially, we do your normal paperwork. I have experienced staff that have been with me. Some of them, I'm feeling old, but getting close to 10 years now. So my medical assistants and nursing staff a lot of times are able to categorize your condition and maybe even give you a hint of treatment options to come.
Right.
So we'll do a thorough workup and try to develop a treatment plan in office while you're there. One thing I love about my profession, many times we're able to provide therapy in office, whether you need an injection or bracing or taping. And we try to treat the problem directly and provide relief immediately or shortly after, whether an analgesic or a pain reliever can be prescribed. We'll provide testing and x-rays as needed. And hopefully you leave the office with clarity in your condition, hopefully some relief from care, and a plan for the future treatment of your condition.
Very good. So, Dr. Malin, what are some of the common myths or misconceptions about podiatry that you wish more people understood?
Sure. Really appreciate that question. As a profession in the last 10 to 15 years, my governing body has really set a goal for parity as a profession, along with our MD and DO colleagues. We are medically trained physicians of the lower extremity. I spent 4 years at Temple University, as well as all my other colleagues will spend 4 years at a podiatric medical school, and training is now standardized. We all go through at least 3 years, some 4, some 5, of surgical training dedicated to the lower extremity specifically. In my training, I performed in the thousands, over 2,500 surgical procedures, and now 9, almost 10 years in practice here in Kentucky, we're in the thousands as well as far as surgery goes. So I want patients to feel comfortable and confident in my training and care, and know that as a profession, podiatry is becoming the standard of lower extremity care.
Yeah.
And if you look from hospital to hospital, that's evident that facilities are hiring and staffing podiatrists.
Very good. Thank you for sharing that. So what do you enjoy most about practicing medicine in a community like Versailles?
Sure. Versailles specifically is so rich in its history, just community values. We have a beautiful downtown here, horse culture, bourbon culture, and really some deep roots in this community that led to our family choosing to live here and buy our first house and practice. And I couldn't be more grateful to be a part of this community, and that includes the medical community and a tight-knit hospital system.
Right.
I feel very grateful having lived across the country and being able to compare to choose Versailles as my home.
That's awesome.
Yeah.
This has been a great conversation, Dr. Malin. For our listeners who may be dealing with foot or ankle pain or just want to stay one step ahead, how can they schedule an appointment with you?
So if you Google Jared R. Malin, DPM, I'll come up under both the Bluegrass Community Hospital and Springview Hospital. Our office number is 270-692-5272. So either way, you'll be able to get in touch with us.
Very good. Thank you again, Dr. Malin. Thank you for your time. Thank you to all of our listeners for joining us on this episode of Check Up with Bluegrass. Stay healthy, take care of your feet, and we'll see you next time.